Much like humans, drugs go through a life cycle. They're born, they grow, they thrive, and eventually they fade away. But what if pharmaceutical companies had a way to extend this life cycle and maximize profits? Today, we'll uncover the clever strategies that help keep drugs on the market for longer, delaying their decline and boosting their bottom line. The life cycle of a pharmaceutical product mirrors that of a human: birth, growth, maturity, and decline. The key stages of this life cycle, introduction, growth, maturity, and decline, are typically visualized with revenue on the y-axis and time on the x-axis. But here's the twist. Pharmaceutical companies face a unique challenge because of the patent protection. When a drug is developed, it's granted a 20-year patent, but due to the long research and development process, market exclusivity usually lasts only about 8 to 13 years on average, depending on which source you want to trust. This creates a high-pressure race to maximize profitability before generics flood the market. Let's break this life cycle down into 3 distinct phases. The first phase is the early stage. This is where the heavy lifting happens. Research, discovery, and rigorous testing are key here, with companies investing massive resources with no sales revenue at all. They're prepping for the eventual drug launch. The second stage is the middle stage, which covers launch and commercialization activities. This phase begins with the drug's market entry and lasts until market exclusivity ends. Early in this stage, the focus is on raising awareness, driving sales, and capturing market share. A period of rapid growth follows, but eventually sales plateau as the drug matures. When the sales begin to decline, the company typically works to consolidate its market position and reduce costs to maintain profitability. The final phase is the late stage. This begins when the patent expires and generic competitors enter the scene. Unless companies apply defensive strategies, sales will decline, but there's still time to pivot. So how do pharmaceutical companies keep their products relevant after the patent runs out? 3 common strategies they use include evergreening, flanking, and Rx-to-OTC switching. Let's start with evergreening. This strategy involves extending a drug's market exclusivity beyond the original patent expiration. Companies file for secondary patents on slight modifications of the drug, such as new formulations, new combinations, or even new indications. Some also patent new manufacturing processes or enantiomers. While evergreening can delay generic competition and maintain high prices, it's controversial as it can drive up healthcare costs and limit access to affordable generics. One proposed solution to this issue is contractual genericization, which I've already covered in another video. A second strategy is called flanking. Flanking strategies are designed to protect market share after a patent expires, even when generic competition is inevitable. One common approach is through authorized generics. Here's how it works. Branded drug companies can partner with a generics company or even use their own subsidiary to produce a generic version of their own drug. This allows the branded company to maintain control over the market while generating royalties on the generic sales. By allowing only one generic version to enter the market early, the branded company discourages other generic manufacturers from trying to compete, since profit margins in the generics market are relatively thin. This limits market erosion and helps the branded company retain revenue even after patent protection ends. For generic companies, these partnerships are also beneficial. They don't need to invest in expensive manufacturing facilities since the branded firm handles production. The branded company, in turn, benefits by recovering more of its R&D and manufacturing investment while maintaining a presence in the market. Flanking strategies are a smart way to soften the blow of patent expiration while maximizing profitability. The third strategy is Rx-to-OTC switching. Switching a drug from prescription to over-the-counter status is a powerful strategy for extending a product's life cycle. It opens up a broader consumer market and reduces the impact of generic competition. But it's not as simple as changing the label. It requires careful planning and regulatory approval. Pharma companies must demonstrate that the drug is safe for self-administration and that consumers can understand how to use it without professional supervision. Successful switches often rely on real-world evidence and consumer insights to identify unmet needs and guide product positioning. Smart labeling, digital tools, and clear instructions are key to helping consumers select and use the product correctly. A well-executed switch can breathe new life into a drug, boosting sales and reinforce brand recognition even after patent expiry. Pharmaceutical companies operate under immense pressure to maximize returns within their limited window of market exclusivity. The drugs that make it to the market are survivors themselves, given that most drugs fail clinical trials, which is why the pharma company wants to recoup as much money from their surviving winners as possible. Strategic lifecycle management isn't just about keeping products on the market. It's about sustaining profitability and staying competitive in an increasingly crowded marketplace. However, it's important to remember that these strategies should aim to provide value to patients and improve outcomes, and not simply exploit regulatory loopholes or delay competition unfairly. If you found this breakdown helpful, hit the like button and subscribe for more insider insights on pharma strategies. Do you have a question or want me to dive deeper into a specific topic? Then drop a comment down below and I'd really love to hear from you. Thanks for watching, and I'll see you in the next video.